Okay. Good afternoon, everybody. Welcome to the Health and Social Services Subcommittee. Today, we have two items on our agenda. The first is a quick vote on a departmental bill from the Department of Human Services, HB 251. Colleagues, we heard this bill this week. Thank you, Principal Deputy Secretary White, for presenting it with your team. What this bill does is it alters the frequency of financial and compliance audits of local departments of social services from at least once every 3 years to an interval ranging from 3 to 4. There was no opposition, no testimony from anyone else. I think we don't have any amendments, correct?
There were amendments submitted by the Senate.
We'll get it worked out before the full vote.
Okay, so we need the conforming amendments to the Senate bill. So what we're going to do today is vote out the House bill as introduced, and then we'll adopt the amendments in full committee tomorrow when it's on the vote list, okay? So for the purpose of today, do I have a motion in favor of the bill as introduced, HB 251? Thank you. Motion by Vice Chair Jones, second by Delegate McCaskill. All those in favor, please signify by saying aye. Aye. Any opposed? Okay, the ayes have it, unanimously voted out. Thank you so much. All right, we will now move on to the second item on our agenda, which is today we have the Department of Human Services Family Investment Agency budget hearing. Welcome to everyone here for that conversation. We do have a couple of witnesses signed up as well. So as usual, we will begin our conversation inviting our DLS analyst, Tanya Zimmerman, to provide her feedback. This is a very thorough analysis, 71 pages, so we appreciated all of the depth that you went into, and we look forward to your presentation. You can begin when ready. Thank you.
Thank you, Madam Chair. On page 1, this shows the overall change in the agency's budget between fiscal 2025 and 2026. The budget decreases by about $50 million or 1.8%. However, if you exclude $72 million of deficiency appropriations that are related to fiscal 2024 expenses, it would increase by $22.7 million. If you turn to page 7, this begins the discussion of the agency's performance, but if you actually turn to page 8, Exhibit 1 shows the trends in applications. Overall, applications have risen across all 3 benefits in calendar 2024, and they were about 33% higher in calendar 2024 than pre-COVID, and TCA and TDAP are also significantly higher than they were pre-COVID. In fact, for TCA and TDAP, some of the highest months since the restart of recertification occurred during 2024. Exhibit 2 on page 9 presents information on the average days to process application for the 3 benefit programs. In general, applications are to be processed within 30 days, though SNAP has a requirement for expedited SNAP benefits to process those in 7 days, and so as a result, the application processing time for SNAP is considerably lower than TCA and TDAP. The difference is about 11 days for TCA and about 17 days for TDAP in the most recently completed quarter. And we've asked the department to comment on the recent increases in applications and efforts to reduce processing times for TDAP. If you turn to Exhibit 3 on page 11, this reviews application denial rates by benefit type. The application denial rates for SNAP are considerably lower than TCA and TDAP. They're generally under 30%. For TCA, they're generally over 70%. For TDAP, they're higher than that and have been at or near at or above 80% since September 2023, though this is higher than the earlier portions of 2023. The TDAP denial rates are higher partially because there are more requirements to receive TDAP related to disability length, and SSI-related activities. And so those higher barriers lead to higher application denial rates. Exhibit 4 on page 12 presents information on some of those reasons for TDAP application denials and how they affect those denial rates. In general, no eligible members is the highest reason for application denials. Verifications is generally the second highest reason, though in some months it is the highest. There are more verifications kind of required related to TDAP, and so that is a contributing factor. And the SSI-related denials generally are around 6%, but they went up earlier in the calendar year but have come down in recent years. And we've asked the department to discuss efforts to reduce denials due to verifications and SSI-related factors in TDAP. Exhibit 5 on page 13 presents information on the share of application denials related to non-cooperation with child support. Chapter 457 of 2020 altered the sanction policy for non-cooperation to reduce the benefit rather than close cases related to child support. However, the department may still deny applications for failure to cooperate. From October 2021 through September 2023, non-cooperation with child support represented fewer than 5% of application denials in nearly all months. And in some months, data wasn't even reported because it wasn't a top reason for denial. The denials related to this reason have increased in recent months and were 21% in August and have been around 20% since then. And we've asked the department to discuss the factors contributing to the growth in application denials due to this reason and efforts they're undertaking to increase cooperation to reduce the denials. If you move ahead to page 17, Exhibit 8, this is looking at the share of case closures related to failure to reapply. Failure to reapply may indicate that there are barriers to applying, but it also may indicate the individual or household understands they may not be eligible. This is the predominant cause of case closure for SNAP, generally over 70%. It was lower in the most recent 2 quarters, and that's been impacted by the increases in closures related to the time limit for able-bodied adults without dependents that we'll discuss a little bit later in the presentation. Page 19, Exhibit 10, looks at the cause of case closures for TDAP. For a period of months between December 2021 through October 23, the department was not able to report due to the change in the eligibility system on the number of case closures due to disability status. They are now able to report that again, and the share of case closures due to this reason has increased since they've begun reporting it, and was 45% in the most recent quarter. And we've asked the department to discuss the cause of the closures due to that reason. Moving ahead to page 23, this relates to, the top of page 23 relates to fiscal 2024 actions. The first part of the discussion was related to kind of reversions that were discussed in the overview. The second part is related to a specific reversion of $100,000 that was required as a result of funds that were not released pending a report on the status of repeat audit findings. In the kind of follow-up, OLA submitted in the report, they indicated that they had only resolved 1 of the 5 repeat findings. Consistent with the request of the Joint Audit Committee, Audit and Evaluation Committee, DLS recommends adding language restricting funds pending resolution of the repeat audit findings, since the funds were not released in fiscal 2024 due to this reason. Page 24 begins the discussion of the proposed deficiencies. There were 12 proposed deficiencies, totaling about $113 million. About $72 million of those were related to fiscal 24 costs. Of the remaining $40.5 million, approximately $20 million are related to aligning the assistance payments programs expenditures with the anticipated costs in the program in that year. Of the remaining amount, about $18 million is related to the Maryland Office for Refugees and Asylees due to increasing numbers of refugees and humanitarian immigrants in the state. Page 25 begins the discussion on the cash assistance benefit levels. Under state law, the governor is required to provide sufficient funding to ensure that TCA benefits, when combined with the SNAP benefit, equals 61.25% of the Maryland minimum living level. Under the Maryland minimum living level, TCA benefits each year are impacted not only by inflation, but the level of benefits set for SNAP by each year by USDA. And Chapter 408 of 2018 tied the TDAP benefit levels to the maximum TCA benefit level for a one-person household, although the chapter required it to be phased in or authorized it to be kind of phased in over time. In practice, the state has provided the full one-person household benefit for TDAP recipients since January 2022. As I mentioned, it's inflated, it's updated based on inflation and also the SNAP benefit level. Historically, the calculation has been made in advance of the start of the federal fiscal year to coincide with the change in the SNAP benefits, which is the second component of the benefit calculation. In a break with historical practice, DHS did not calculate the update until November 2024 and did not provide the benefit increase until January 1, 2025, despite a benefit increase being required. If you look on page 26, Exhibit 13, this kind of provides the history of recent benefit levels. In most years, this does increase. Since fiscal 2019, the benefit had basically, or since fiscal 2020, the benefit had been at kind of a stable level due to SNAP benefits increasing at a higher rate than inflation. This year, they announced SNAP benefits increased by only $2, which was much lower than inflation, and so the benefits were required to increase by about $26 for a three-person household to meet the minimum living level. The monthly data provided by DHS to DLS kind of confirmed that the TCA recipients received the increase in benefits as stated for January 2025. Initially, the data did not indicate that the TDAP benefit increase had occurred. Since then, additional month of data does show that the TDAP benefits were increased. However, DLS is still asking the department to comment on the cause of the delay in completing the calculation and why they did not provide the benefit increase in October as has historically occurred. Page 29 shows the overview of agency spending excluding the assistance payments, which is the largest portion of the spending. This spending is about $430 million. About 47% of that is personnel. About 45% is contracts and grants. About 46.5 million of those contract and grants are related to kind of other contracts and grants, of which 22 million is related to the call center contract, which you heard about as part of the DHS administration analysis. As part of this analysis, we're asking the department to comment on when they will realign the funding that's budgeted in the Family Investment Administration for the call center contract in fiscal 25 and 26. Exhibit 16 on page 30 and 31 present the 8 major areas of change in the agency's budget. Most of those occur in personnel as well as rent. The rent is primarily driven by some mechanical system upgrades and a lease renewal for one office in Baltimore City. Turning ahead to page 35, this is reviewing the adequacy of the funding within the assistance payments program. In both fiscal 2025 and 2026, DLS is projecting that the budget has a surplus, about $3.5 million in 2025 and $2.3 million in 2026. This is driven in both years by the public assistance to adults. The caseload has really declined over the last couple of years, but the budget remains at kind of a higher level, not reflecting that decrease. And DLS is recommending reducing $1.75 million in fiscal 2026 to reflect the level of spending in the program. In the SNAP program, the budget provides $1.86 billion. This would provide benefits to approximately 452,000 cases. The average number of cases through December is around 382,000. And DLS is recommending reducing the federal funds by $200 million to better align with anticipated spending. This still leaves a surplus of about $150 million in the event of a caseload growth. The issues begin on page 1. The first is related to the voluntary settlement agreement. On October 10th, 2024, the Office for Civil Rights at the Department of Health and Human Services announced a settlement agreement with Maryland related to civil rights of persons with disabilities related to programs funded by the Department of Health and Human Services, including those in the Assistance Payments Program, as well as programs like Medicaid, child support, and energy assistance. As this came about related to 12 complaints that covered the period from 2011 through 2022. As part of the announcement, the Office for Civil Rights announced that the investigation found systemic concerns related to a lack of consistent approach for assessing disabilities and related modifications or accommodations, and a need for statewide policies and procedures related to providing reasonable modifications and accommodations. In October 2024, a comprehensive review that was required under legislation in 2022 was released. It covered a number of areas, some of which are relevant to the settlement agreement. In general, some of those kind of relevant findings were related to not having a standard assessment tool, challenges in referrals to services for individuals with disabilities, and inequities in the granting of good cause. Page 39 begins some of the discussion of the requirements of the agreement. Most of the timelines in the agreement are based on the number of days from the effective date of the agreement. DHS reports that the effective date was August 13th, 2024. Part of the requirements was a certain amount of notifications within 90 days of the agreement. DHS was required to provide notifications, including posting on the department's website and social media about the agreement, which was also required to be posted in the state and local offices. And notifications were required to be mailed to all those whose TCA cases were closed since July 1, 2021, under certain circumstances, particularly related to non-cooperation with eligibility and work sanctions. Although it was required to be posted within 90 days on the department's website, DHS did not post the agreement until February 3rd. They have not yet sent the notifications. They're anticipating doing that by April 18th. DLS had estimated about 14,821 notifications may need to be sent based on the number of closures due to non-cooperation with eligibility. And we've asked the department to comment on why the agency was delayed in posting the notices on the website and the delays in sending the notices to TCA recipients, as well as whether they've posted the notices at the local offices as required. The secretary is required to identify one universal assessment tool to be used by all local departments. The department anticipates that new assessment tool will be implemented in December 2025. DLS has identified a few costs related to the settlement agreement, including modifications to the enrollment and eligibility system, which are required to be made within 180 days of the effective date. And those mostly relate to kind of having information about the disability status and those requiring accommodations. And we've asked the department to discuss the timeline for determining the costs and how they will be covered within the budget. Two additional portions of the settlement agreement could create a potential cost liability, and that relates to the review of the cases that were the basis of the agreement and other cases that are required to be notified of the agreement. With these notifications and these reviews, that may lead to appeals of the case closure or reductions in benefit levels, which could lead to reinstatements of benefits or retroactive benefit payments. And we've asked the department to discuss the number of individuals expected to be provided notification, the timeline for appeals, and we've also recommended restricting funds pending a report on those notifications, the number of appeals, including those lost in the dollar value of benefit required to be paid as a result of that, as well as the status of other areas of the agreements. Turning to page 42, Exhibit 2 looks at case closures due to hitting the time limit. Federal law prohibits cases headed by an adult receiving TANF-funded benefits from receiving benefits for more than 5 cumulative years. However, federal law provides the option for exemptions to the time limit for hardship. Under that exemption, under that provision, 20% of the caseload receiving TANF-funded cash assistance from the prior year can receive that type of exemption. Historically, DHS has granted this hardship exemption to all cases hitting the time limit because they were well below the 20%, and therefore few, if any, cases were closed. One of the audit findings was related to this, and subsequent to that, the department has started closing cases hitting the time limit. If you turn to Exhibit 19 on page 44, this shows kind of the data around this. Although the audit came out a number of years ago, the case closures didn't really begin until July 2023. They began to really increase kind of later in that year, around November, and kind of spiked in December, at which time there were about 2,000, almost 2,100 cases closed in that month alone. Across fiscal 2024, about 6,661 cases have been closed to this due to this reason through October, compared to very few, if any, in prior years. In addition, applications have been denied due to this time limit, and that's been about 100 per month since around the same time period. Issue 3 begins on page 45. This covers the summer food benefits for children, the Sunbucks program that was authorized in the Federal Consolidated Appropriations Act of 2023. The department implemented the program in the summer of 2024 and has provided notice to USDA that they intend to provide it again in 2025. Exhibit 20 on page 47 presents the number of unique recipients of the program benefits in 2024 and the total dollar amount provided. Page 48 discusses the administrative costs. In fiscal 2025 budget as enacted, there was $11.6 million related to the administrative expenses of the program. The funds were budgeted in the assistance payments program, which is used only for benefit payments. As a result, language in the budget bill required the funds to be transferred to the director's office in FIA. However, they have not yet initiated this transfer, and we've asked the department to comment on the timeline for transferring the appropriation. Although they were requested to provide details on the administrative expenses in a report, the department provided limited information on that. However, they did subsequently provide information related to their 2025 spending plan. Most of the funds support 100 contractual full-time equivalents, about $7.1 million for those personnel costs, as well as kind of associated equipment. And there are additional costs related to the EBT issuances and IT needs. Of the 100 positions, as I noted, they're contractual full-time equivalents. However, the budget data doesn't actually show that there are those contractual full-time equivalents, and we've asked the department to discuss why the budget does not reflect those and why they're using contractual positions, given that this is an ongoing program and they have available vacant positions. The fiscal 2026 allowance, again, includes the same level of funding for administrative expenses, which are, again, budgeted within the assistance payments program. The department notes this is a technical error. Of the 100 contractual full-time equivalents, the department indicated at the end of January only about 80 of those were filled. In addition, as I mentioned, the department has a number of vacant positions throughout the Family Investment Administration. And so due to the kind of lower number of filled positions than they have funding to support, as well as their overall vacancy rate in the Family Investment Administration, DLS recommends reducing the administrative funds by $2.2 million, and also recommends deleting the remaining funding out of the assistance payments program, but adding it back into an administrative program to a more appropriate place to budget. And we've also recommended adopting committee narrative requesting a report on participation in administrative expenses. The final issue in this analysis is related to the able-bodied adults without dependents time limit in the SNAP program. These individuals are limited to receiving benefits for 3 months in a 36-month period unless meeting certain work hours. The upper age limit to which these requirements apply was increased through October 1, 2030 through the Fiscal Responsibility Act. Due to the national public health emergency, the requirements were suspended through June 30, 2023. Since the end of the requirement, waivers have been in place for portions of the state. Still, the jurisdictions to which those waivers apply varied between the prior year and the most recent year. In addition to the exceptions, the department receives discretionary exemptions that they can use to relieve the requirement for 1 month per exemption. Due to kind of a historical buildup of those exemptions, the department was initially able to use those rather than kind of enforcing the requirements. However, beginning in June 2024, they began closing cases due to the time limit as the exemptions started to run out. Since that period between May and October 2024, about 18,500 cases were closed due to meeting the time limit. DHS reported case closures due to the time limit in all jurisdictions and data provided to DLS, including jurisdictions in which waivers were in place, including Baltimore City, which had about 1,100 closures in that time period, despite having a waiver. And we've asked the department to discuss the reason for the closures in jurisdictions with waivers in place and outreach and other efforts undertaken to limit the number of case closures due to the time limit. Page 52 begins the discussion of the recommendations. I'm only going to cover those I haven't already discussed. The first is related to the closeout issue that was heard as part of the overview analysis, restricting funds pending submission of the closeout information. The second recommendation on page 53 is generally annually language related to restricting funds in the assistance payments program to that purpose. This is consistent with other entitlement programs. The exception this year is that it would apply to all appropriations in the assistance payments program rather than just general funds related due to some of the closeout issues that occurred in fiscal 2024. Recommendations 3, 4, 5, and 6, 7, and 8, I think I've already covered. So recommendation 9 on page 56 is language that restricts funds pending quarterly reports on application processing times, denial rates, and case closures. This is similar to items that have been adopted in prior years, except for it's in language this year and adds the public assistance to adults to that requirement. Recommendation 10 was also previously discussed. Recommendation 11 on page 58 applies the restriction on using the general funds for the TDAP program to a deficiency program, deficiency appropriation as well. And recommendation 12 was already discussed. There are a number of updates which I won't discuss throughout the rest of the document, but I'm happy to take any questions.
Thank you, Ms. Zimmerman. Does anyone have any questions for our DLS analyst? I have one. I don't know if it's best addressed to you or to the department. So if it's not best addressed to you, I'll hold it and you just let me know and we'll go to the department panel after. But on page 35, you have a coverage here in your analysis on SNAP. And you noted that the FY26 allowance supports approximately 452,000 SNAP cases, but the average number from FY25 through December 2024 has been 382,035. Do we have a sense of how many of these individuals receive the state expanded funding from the general fund, or is it all federal?
For the, so this particular funding is just the federal funding. If you're looking at the senior SNAP program itself, the chart on Exhibit 17 on page 33 shows that, although the numbers are not exactly in the chart. So As you can see, the number increased around October, around September, actually, and that was related to the expanded eligibility under the legislation you passed last year. It was around 32,000 in December, which was the most recent data available at the time of the analysis. Prior to the implementation of that, the number of cases had been about 27,400. So it increased.
Great, because it expanded because we lowered the age eligibility, right, to 60?
And increased the
Dollar amount, right. But the caseload in that program increased in part due to the lower age eligibility, I'm assuming? Okay, that's good. That means what we did last year worked. We're feeding more people, so that's good news. So on your recommendation then related to reducing federal funds by $200 million to align with anticipated spending, none of that implicates general fund savings potentially because it's all related to those only receiving federal benefits, not general fund subsidies.
Yes, and if the benefits were needed at that level, they could bring in a budget amendment to do that. But this is just reducing kind of excess appropriation to better align with the benefits that they're actually providing.
Got it. And I see that you've still, even with the $200 million reduction, there's still approximately $150 million in the event of unexpected caseload growth, which we might see based on federal stuff. So this is helpful to understand. Thank you. Other questions? I see Delegate Ruff.
Thank you, Madam Chair, and thank you for your analysis. I had a question about one of the line items on page 31 in the proposed budget increase of $2 million for refugee health screenings. Can you tell us where the source of those funds could be?
Yeah, so that's part of the Maryland Office for Refugees and Asylees, and that program, except for about $5 million that has been dedicated over the last few years related to immigrants resettled from other areas, is solely federally funded.
Got it. Thank you.
Thank you. That's a great question. Thank you. Okay, thank you. Really appreciate your analysis and responses. We'll now invite our DHS team to the table, please. Madam Principal Deputy Secretary White, please come up, bring whatever team members you wish, and you may begin when you are ready. Thank you.
Good afternoon, Chair Shetty and members of the subcommittee. For the record, I'm Carnitra White, and I serve as the Principal Deputy Secretary for the Department of Human Services. We'd like to thank Governor Moore, Lieutenant Governor Miller, the Department of Budget and Management, and the budget committees for their support. We also would like to thank Tanya Zinneman, our DLS analyst for her budget analysis. Joining me at the table today are Augustin Nabaganamani, our Executive Director of the Family Investment Administration, as well as Jessica Smith, our Acting Chief Financial Officer. We also have members of our leadership team in the audience. I'd like to point out we have our Director from Caroline County Department of Social Services, Sherry Blades, with us today, as well as our Director of Kent County Department of Social Services, Shelley Neal Edwards, with us today. While you have our written testimony, I'd like to highlight a few items and then address the issues that were raised in the analysis. First, this past summer, we launched the Summer Bucks program, the Sun Bucks program, an initiative aimed at supporting children who lack access to free school meals during the summer break. Sun Bucks is now Maryland's largest investment in the fight against childhood summer hunger and would not have been possible without your support. And so thank you for your support. With the investment of $5.8 million in administrative funding, we were able to leverage a direct federal administrative one-to-one match and over $71.5 million in direct summer nutrition benefits to more than 594,000 students across the state in all 24 jurisdictions. Our 2024 Sun Bucks work represents a six-fold increase in the number of children receiving summer SNAP benefits from 2023. I think this is something that we all are proud of. In certain regions, the impact was even more dramatic. On the Eastern Shore, we served more than 10 times as many children than we did in 2023. And in Western Maryland, we served 71 times as many children as we did in 2023. Our team is proud of the work that it took to stand up this successful program in just 52 days. Using the $5.8 million investment, we hired 80 staff, we made necessary software and system changes, we issued EBT cards so that on June 30th, 2024, food was on the table in families across the state. We were successful in our efforts because we did the work to automatically enroll families, not requiring them to demonstrate eligibility over and over again. The process was seamless, simple, and swift. We're deeply grateful to our partners at the Maryland State Department of Education and the Department of Health for their critical partnership in this effort. We were able to take their data and match it with our data so that we wouldn't have to have people apply. If they were already receiving farms, if they were already receiving medical assistance, we were able to automatically enroll them in the program. And we look forward to your continued partnership to continue to put food on the table when school is out. In addition to our work with Maryland's children, we also increased our senior support by implementing the 2024 Senate Bill 35 that the chair just mentioned, which increased our SNAP benefits for older adults. In particular, we thank you, Chair Shetty and Chair McCray, for your leadership in getting this bill passed. If a SNAP household includes an individual 60 years or older and receives less than $50 in the federal funding benefits, we provide a supplement to ensure the total benefit reaches the state minimum of $50. SB 35 has already benefited nearly 30,000 households, making a meaningful difference in the lives of Marylanders over 60 years of old who rely on SNAP. Also critical to our work serving Marylanders through the nutrition benefits are our efforts to protect and replace those benefits. Since March 2023, we have replaced $35.2 million in stolen benefits for nearly 61,000 Maryland households. As of November 20th, 2024, the federal government is no longer funding the replacement of stolen SNAP benefits. Stolen SNAP benefits make up about 79% of all benefits stolen from Marylanders. We're using the FY25 appropriated state general funds to continue to replace stolen benefits. In the fall of 2023, we introduced the new electronic benefit transfer card security features, including the ability to lock and unlock your card. So we all have that feature on our credit cards or debit cards where we can lock and unlock, and that feature is also available on our EBT cards. And we also have a alert monitoring transactions, so our customers are able to receive alerts if there are certain transactions and be able to identify fraud quicker. On average, monthly reimbursements of stolen benefits have decreased by over 20% in the past 10 months compared to the first year of the program implementation. We still have ways to go, and we remain committed to working with our federal partners to enhance protection. We continue to look for innovative solutions to achieve the governor's goal of ending childhood poverty and leaving no one behind. In 2025, we launched 2 new initiatives to assist us in these efforts. First, to expand our outreach and strengthen our community partnerships, we created the Office of Benefit Access. This office will spearhead our outreach efforts and ensure that Marylanders can easily access available resources and benefits. Second, we launched a new partnership that brings together Cash Campaign of Maryland, our Maryland Corps members from the Department of Service and Civic Innovation to establish a voluntary income tax assistance sites in our local departments in Baltimore County as well as Prince George's County. Maryland Corps members receive specialized tax preparation training and IRS certification through the Cash Campaign. Working with the Comptroller's Office and Bank on Maryland, this partnership provides free tax preparation to eligible households. Tax preparation helps customers retain more of their hard-earned money and access valuable credits such as the Earned Income Tax Credit and the Child Tax Credits. These credits have been effective in reducing childhood poverty. Both of these efforts are bold new solutions to assist Marylanders in accessing available resources and services. Finally, I would like to express my heartfelt gratitude for your continued support of our work and give a special thanks to our employees across the state. Their commitment ensures that every Marylander has the resources to address the immediate challenges and achieve long-term success. Now I'll turn it over. Now we'll turn to our responses to the DLS analysis, and I'll turn it over to my colleague, Augustin Nabaganamani, who will address the first 6 issues.
Thank you, Deputy Secretary Wright. Good afternoon, everyone. I will start with the response to issue number 1 regarding the cause for recent increases in applications, particularly for TCA and TDAP, and efforts to reduce application process timeliness for TDAP. We believe that the rising economic pressure from inflation might be prompting more individuals to apply for benefits across the board, particularly for TCA and TDAP. The application process timeliness for TDAP has not increased. The department continues to consistently meet the 30-day processing requirement and remains committed to continuous improvement. We have provided additional links and discussions on this issue on our written response. On the issue number 2 regarding efforts to reduce TDAP application denials due to verifications and SSI-related corporations, the department has a contract with Maximus to help TDAP recipients pursue SSI benefits as a condition for receiving and maintaining TDAP benefits. Every TDAP applicant is advised of this service, which is available at no cost to the recipient. With regard to issue number 3, regarding factors contributing to the growth in TC application denials due to failure to cooperate with child support and efforts we are undertaking to increase the cooperation, federal law requires TCA applicants to cooperate with child support services as a condition of eligibility. State regulations outline specific cooperation requirements, including parent identification, paternity establishment, and support collections effort. We recognize that this can present barriers for some households. This year, we are working to identify opportunities to reduce barriers while maintaining program integrity and aim to better support applicants. On issue number 4 regarding the cause of recent increase in TDAP closures related to disability status, I'll say that according to our most recent joint committee report regarding case closures, application processing and denials, and the recent increase in the TDAP closures related to disability status are due to the following reasons. Number 1, the applicant was deemed not disabled or was not determined unable to work by a healthcare provider. Second, the applicant did not complete an SSI application. Third, the applicant was employed and receiving earned income. On issue number 5, regarding the recommendation to add the language restricting funds pending a resolution of the audit findings. We do not concur with this recommendation to restrict funds, as we believe we have made significant progress towards resolving repeat audit findings. In the October and December letters from the Office of Legislative Audits, the auditors advised that FIA has satisfactorily implemented recommendations for 2 of the 5 repeat audit findings. We believe that the remaining findings are effectively resolved as well. We submitted a detailed quarterly status update to OLA on February 18th and look forward to a more in-depth conversation on this subject. On issue number 6, regarding the request to discuss the cause of the delay in completing the calculation of TCA benefits and whether the increase in benefit was provided to TDAP recipients. TCA benefits are based on an annual Maryland minimum living level calculations. Following recent calculation, TCA benefit increased for the first time since 2019 with an effective date of January 1st, 2025. TDAP benefit did increase during the same month as we made eligibility changes. Now I'll turn the mic over to my colleague Jessica to talk about the next 2 issues before I continue. Over to you, Jessica.
Response number 7, DHS should discuss when this call center funding realignment will occur for fiscal 2025 and 26. We intend to make this realignment for fiscal year 2025 with the submission of the final budget amendment. We intend to make this realignment for fiscal year 2026 within the first quarter of fiscal year 2026. In response to number 8, reducing the federal funds for SNAP by $200 million. We do not concur with this recommendation and support the governor's introduced budget. In this time of economic and federal government uncertainty, we do not recommend that federal funding flexibility be reduced.
I promise I'm not playing with the mics. So it's my first time here, so bear with me. On issue number 6, regarding the voluntary resolution agreement with the Office of Civil Rights, regarding the notice delays, we regret the delays in the posting those notices. The delay was due to staffing turnover. We have implemented corrective actions. We have posted the notice to our website. Notices to be posted with the local, within local departments were sent out this week. With regards to issue number 10, to discuss timeline for determining the cost of E&E modifications and the related VRA, we do estimate that the cost to implement the system changes would be roughly $146,000. In coordination with them, do you think we will be submitting an as-needed advanced planning document to request additional federal funding for this activity? The system changes have been given the highest priority, and we are planning to get them completed by the end of June 2025. On issue number 11, regarding the number of individuals receiving VRA notices, the timeline for appeals, and a report on the status. We will provide the requested report, but we do request that the funding remain unrestricted so that we can implement the VRA. Our initial analysis suggests that roughly 11,000 individuals receive these notices. We expect that a small subset of those individuals will appeal or reapply for benefit. We described the appeal process in our written testimony. I'll go back to Jessica to address the remaining issues.
Response number 12, transferring the appropriation for Sunbucks administrative funds from the Assistance Payments Program. We will work with DBM to submit a budget amendment to transfer the Sunbucks administrative funds from the Assistance Payment Program prior to submitting the final fiscal year 2025 closing budget amendment. In response to number 13, position counts and Sunbucks contractual FTEs. Sunbucks positions were initially unbudgeted and without state merit pins. As a result, we created contractual positions in order to issue benefits by June 30th, 2024. We have created 100 contractual positions for the Sunbucks program in the Workday system. Of these positions, more than half were filled by June 30th, and since then, 80% of the positions have been filled. Some employees have moved to state merit positions. We continuously recruit for these positions. Of the 100 positions, 95 are in local departments. 16 of the unfilled 20 positions are in our local departments of social services. DHS has taken deliberate steps to reduce vacancies within the Family Investment Administration. On January 1, 2023, the vacancy rate across FIA was 15.54%. On February 13th, 2025, the vacancy rate was 7.10%, down by 8.44%. We are actively working to continue to reduce vacancy rate to meet the scope of responsibilities within FIA, which has grown over time. As we indicated in testimony last year, we believe that the department has been systemically under-resourced for a number of years, and that the scope of responsibility has not kept up with the availability of resources. As a result, all positions are valuable, including the funding for these contractual positions, and allocated to take on needed tasks. Response number 14. Therefore, DLS recommends reducing the administrative funds by $2.2 million based on current staffing levels and the availability of funding through vacancy savings to support the administrative expenses. DLS also recommends deleting the remaining $9.4 million from the Assistance Payments Program and adding these funds to the Director's Office for this purpose. In addition, DLS recommends adopting committee narrative requesting a report on summer 2025 participation, issuances, and details on administrative expenses and positions supporting the program. We concur with the report requests, but we request a due date of December 1, 2025 to align with federal reporting requirements. We do not concur with the proposed administrative funding reduction. It is impossible to estimate vacancy savings for a program that has only existed since June 2024. Any reduction in our personnel staffing will directly impact our ability to implement SUMBUCS in 2025. We implemented SUMBUCS in 52 days to ensure that children would not experience food insecurity during the summer. As of January 2025, 80% of the positions have been filled. 56 of the positions were filled by July 5th, 2024. SUMBUCS staff determine eligibility on program, applications, manage return cards, conduct outreach, manage appeals, correct errors as necessary, and manage inquiries for nearly 600,000 recipients. The case managers also work with local school systems to address concerns raised by parents and guardians. They manage fair hearing requests and support clients through the fair hearing process. A reduction in state general funds will directly decrease the amount of federal administrative funds on a one-to-one basis, and we will leave federal funds on the table. In addition, we anticipate that it will incur additional mailing and EBT card production and operation costs due to the increase in the estimated population. Our fiscal year 2025 budget was based on an estimated 500,000 recipients. We estimate that 600,000 students will receive assistance this summer. In response to number 15, ABARD-related closures, jurisdiction waivers, and outreach. The report shows ABARD closures in ABARD-exempt jurisdictions is incorrect. The error occurs when a SNAP household subject to ABARD requirement moves to an exempt jurisdiction and vice versa. We are working to resolve the reporting error. Response number 16, and these are the DHS response to the DLS recommended actions starting on page 38. Number 1, a report on various data and an explanation of actual spending details. We concur with the report request, but request a due date of December 1st, 2025. Number 2, restricting funds for N00G0008 assistance payments. We do not concur and request the same exemption as fiscal year 2025 using last year's DLS language stating that funds may be transferred to N00G0001 foster care maintenance, payments or N00G0003 Child Welfare Services budget for the purpose of replacing federal temporary assistance for needy families fund spending. Number 3, reducing Sunbucks administration funds to $2.2 million total. We do not concur based on our previous remarks. Number 4, deleting $9.4 million total in Sunbucks administrative funds and adding them to the director's office. We concur. Number 5, reduce funding by $1.75 million for the Public Assistance to Adults program. We do not concur and support the governor's proposed budget. Number 6, reduce federal funds for SNAP by $200 million. We do not concur for the previously stated reasons. Number 7, producing a Sunbucks report. We concur with the report request, but request a due date of December the 1st, 2025 to again align with federal reporting requirements. Number 8, reducing funds by $250,000 and requesting a repeat audit corrective action report. We concur with the report request, but do not concur with the funding restriction as we have made significant progress in resolving the repeat findings. Number 9, providing various public assistance data quarterly reports. We concur with this report request. And number 10, voluntary resolution agreement reporting and funds restriction. We concur with the report request, but do not concur with the funding restriction as it would hinder our efforts to improve service and implement the agreement. Number 11, budgetary transfer restriction. We concur. And finally, number 12, adding $9.9 million total funds to the director's office from Sunbucks. We concur. This concludes our testimony. Thank you for your time, and we look forward to your questions.
Thank you, DHS team. We appreciate the thorough response. I'm going to start with one quick question, and then I'll turn to my colleagues, and I'm going to come back to me for a couple more. So as you were going through your very thorough response to DLS, something kind of struck me related to, so on page 7 of your response, this is DLS's question related to factors that contribute to the growth in TCA application denials due to failure to cooperate with child support. I think when I read the DLS analysis, I had assumed that the Maryland regs were related to non-custodial parents, that the non-custodial parents who wish to participate in TCA needed to participate in child support. But reading your response, it almost feels like it's the opposite, that the regulations in Maryland actually add in requirements for parent identification, paternity establishment, and support collection efforts. Can you help me understand who the requirements are on, please?
Yes, so the requirements on both ends, but in this particular case, requirements are to the custodial parents.
Okay.
So with the child who are applying for TCA benefits.
So I think this is a little troubling to me because it sort of sounds like people are being denied TCA, or poorest families are being denied TCA if maybe they can't identify a parent or are unable to establish paternity. Is that what's happening?
So that's not the case. There are actually processes for exempting certain households from that particular requirement. For instance, individuals experiencing domestic violence. In some cases, if a parent is living overseas in places where we do not have cooperative agreement with those countries to pursue child support, those individuals are exempt from those requirements.
Wholesale exempt. Okay. Okay. I'd love to follow up offline to understand this a little bit better. This, if these are Maryland regulations that outline this, and we're seeing such a significant drop-off in TCA, or we're seeing an increase in TCA denials based on this, there might be some things we may want to work on to improve the ability for custodial parents to access benefits that they might need. So that just struck me in your response. So let's talk offline about that. Delegate Ruff for a question.
Thank you, Madam Chair. Thank you to the panel for your work. I specifically want to thank you all for the work you are doing for our immigrant community. And I appreciated in your written testimony the discussion about how you've increased the number of our immigrant brothers and sisters in assisting them by almost double from the previous year. Obviously, that is critical in this integral time right now where we're seeing a lot more immigrants resettling into our state in areas that I hadn't even thought about on the Eastern Shore. And I wanted to talk about the federal funding, and that was the reason why I asked our DLS analysts about the source of that specific funding on the increased $2 million for refugee health screenings. But we also recognize the $17.9 million deficiency appropriation that is going to be needed based on your estimate of the 52% increase in medical assistance and traditional cash assistance to refugees. So I wanted to see if you all could discuss kind of what is the contingency plan if if federal funding is not available to sustain these programs. What are we going to do to ensure that these programs are resilient despite potential federal changes?
Yeah, thank you for the question and for your comment. So I would say that first of all, over the last month, refugee arrivals have been suspended, and we are monitoring the situation to determine what this means in the long run. But the refugee program under DHS does not only serve refugees who arrive from overseas. It does serve certain humanitarian migrants who are already here, such as asylees, foreign domestic trafficking, foreign victims of trafficking and other humanitarian parolees. We have not received any communication from the federal government suggesting that the funding that we receive for refugee settlement will stop. And so, again, that's the situation we're going to have to continue to monitor and work with you all to determine how we continue to support immigrant populations if there were any change in the federal policy.
Right, but if there is a change, are we thinking ahead to figure out how to replace those dollars? I mean, it's very likely, or at least possible, that funding could go away. So is that something we can talk about in the future, about thinking ahead and making sure that we have a stopgap for that very specific issue?
We'd be happy to work with you in the General Assembly on identifying how we would do that in the stopgap. We are continuously monitoring and continuously looking at those funds and looking at whether those federal funds are going to be stopped and looking for solutions around not just these, but all of the pending possible federal fund dollars that may not come through for the department. Okay. Our budget is 80% federally funded.
Understood. Thank you.
Thank you, Delegate. Thank you, team. Vice Chair Jones.
Thank you, Madam Chair. That I needed a minute after that stat, 80%. I just want to make sure I heard you right. You said 80% federal?
Yes.
Thank you. Let's flip to page 37 of the report. The OCR voluntary settlement agreement findings. I just wanted to discuss further your testimony and the findings from the department's voluntary settlement agreement with OCR for the complaints related to protecting the civil rights of persons with disabilities. You mentioned the necessary system modifications related to the voluntary resolution agreement, and that it's going to be a little over $146,000?
Correct.
Right? Okay. With the federal and state cost sharing ratio, 90% coverage from federal funds to 10% for the state. How certain are we that the federal funds will come through? And are the expected state funds for this project already accounted for?
The state funds are already accounted for, and we're
Hey, do it one more time for us, for the record.
Sure. The state funds are accounted for, and the we haven't had any problems so far getting our APDs approved by the federal government.
Okay, wonderful. Well, thank you so much. I just also wanted to add quickly, if I may, Chair, how incredibly proud I am to be a part of this team with the Sunbucks, and hearing your report on the Sunbucks truly fills my bucket. So thank you.
Thank you. Thank you for your continued support around it. We're all excited about that.
Thank you so much. Delegate Heinbach.
Thank you, Madam Chair. Before I ask my question, I want to congratulate you and thank you on the Sunbucks program. I represent Allegheny and Garrett County, and the increase in meals provided there was amazing. I'm hoping that it goes up again this year. Not only is that a great program, but the way you went about declaring eligibility for it, I think anytime you can use the data you already have to determine if, rather than go through a big, long application, and that's probably one reason why you had so much better participation. But then a real quick question. If you look at Appendix 2 on page 30, line 13, there's the category is called fixed charges. And it kind of jumps out at you because it increased, it almost doubled. And I'm just curious about two things. What falls under that category of fixed charges first? And then secondly, why did it go up 95%?
I'm sorry, can you repeat the page that you're looking at the chart?
Page 70?
Oh, 70.
Oh, did I say 7?
You said 31.
That was just kind of putting you through an exercise there. You know, to see.
No problem.
While we're turning to the page, I would like to say our partners in Allegheny and Garrett County are also part of the processing units for Sunbucks for across the state. So we chose 6 counties to do processing for the entire state. And Garrett and Allegheny County not only are processing the Sunbucks, but they're also processing stolen benefits. So they're great partners. And so we were not only able to have more dollars there in some of our Eastern Shore counties for Sunbucks, but also staffing as well.
Well, you're very fortunate that you have 2 really good people leading your organization up there. So
They are.
I know both of them. They're both very, very good. So thank you for that. So it's page 70, not
Yes,
page 7.
Yes, sir.
Did I say line 3? I meant line 13.
I think I found it now. In response to your question about fixed charges, this category is mainly budgeted for our leasing and escalation clauses within any of our administrations. And so that's where you will find the majority of those charges being into that category there.
Did your lease, so your leases went up dramatically from what they were before then?
Well, our lease cost and charges based on each one of our administrative program is calculated based on the number of employees in those programs. And so because our local departments can't hold all of our employees for all of our administrative offices, the cost could fluctuate based on how many vacancies, how many field positions they have at that time during the fiscal year.
Okay, thank you. Thank you, Madam Chair. Oh, if you need help this year with Sunbucks, if there's anything I can do to help you up there, to put pressure on them or whatever, let me know. Not pressure, to encourage them to fully participate.
Thank you, we will. And like this, with Sunbucks, there is no local match. So it's all
Yeah.
federal funding, so.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. So I want to just do my question, and then I'm going to end on my comments. So as you know, the child support pass-through is like my #1 thing that I've been irritated about for like 30 years. And so I'm so grateful for the continued opportunity to talk with you and your team about this issue. And as we've heard now in a couple of our budget hearings and several of our discussions, because of a combination of relics of terrible federal laws that are still upheld at the state level across all of the country, DHS does an amazing job of administering the child support program, but is required to pass through under current law only $100 for one kid and $200. And I know, could you first start by telling me what's the average amount for a TCA family? What's their support order?
Don't call me an exact number, but a average monthly benefit for a TCA household of 3, I believe somewhere around $750.
No, I'm sorry. So 750 is the TCA benefit that the one family gets on average. So that's interesting because I remember, I think in some correspondence I've had with you all, you indicated that the average child support order for a family member, for a custodial parent who is enrolled in TCA is about $1,200. And we are only under current state law passing through $100 of that to a custodial parent of one child and $200 if they have 2 or more. Is that about right?
That's correct.
Okay, so they get $750 on average now, and if we, but they get an extra $100 or $200 on top if they, from the child support order when it's paid through DHS. So can you tell us a little bit, I know about half of that money is passed through to the feds and half is maintained at the state level. Can you share with us where the state, that money retained goes? What does it fund?
The money that stays with the state goes to reimburse the state for the benefits of the program that are there.
Got it. And, okay, so I thought also in some correspondence that we shared that there was some workforce development programs as well funded.
So that's in the child support place. There are some non-custodial workforce programs that we have across the state. And
Yes.
that money does also
help support
those.
Okay, great. And I know we've also talked a little bit about whether the Department of Labor has some existing workforce development programs that can be leveraged for similar efforts. Have we found out whether that's the case?
We continuously are having conversations with the Department of Labor on all of our TCA workforce programs so that we can leverage the programming that they have and reduce redundancy.
Sure.
So those conversations are continuous. We do believe there are some opportunities there that we continue to explore.
Amazing. Thank you. I really appreciate that. And so I want to end my section here with just a comment. First, thank you for the feedback, and thank you again for your continued collaboration on the child support remittance policy issue. It's a personal issue for me, having grown up on TCA and SNAP benefits and having 30 years ago had this problem in North Carolina where my mom, who had custody of me and my sister, had all of arrearages basically kept by the state and feds, and it just continued to keep us in a cycle of poverty and hunger. And so I really appreciate the continued collaboration and discussion that we've been having on how we can really get more money into our most vulnerable families' pockets so that we can help allow them to thrive in our state, especially when so much of this is just under attack at the federal level writ large. So I want to just end on a quick comment. Yesterday, when I was going through my budget documents to prepare for today's hearing, I think sometimes, we're in this state of perpetual busyness right now during session, right? And 100-page documents between DLS and amazing response just on one sub-agency. It's easy to get lost in the weeds. But I'll tell you, when I opened your response and I got to page 3, it absolutely took my breath away to see that jump in the bar graph on Sunbucks and how many more children we served in Maryland because of your work and your leadership. And I'm so grateful for the opportunity that we've had as a General Assembly to partner with you all, because to me, these are all babies who were hungry and now they're fed, and that is amazing. And then similarly later on, the number that of 30,000 households of seniors with enhanced SNAP benefits. Like, this is why we do this work. And I got chills, and I have to tell you, I shared with my chairman how grateful I am that we get to do this work with you because, and I don't say this lightly, but it is literally healing some serious childhood trauma for me to see this incredible work being done and just the amount of compassion and care that the administration in partnership with the legislature has shown to all of these children and seniors. So I just want to take a moment again to thank you for that work.
And I want to thank you, Chair Shetty, and members of your committee for your continued support around this. Many of us who work for the department also have lived experience. And so we also take this work very personal. And like you, we get very emotional when we have these great success. I know oftentimes we don't hear these great stories about the good work that we do, but we serve 1 million Marylanders who without our support would be in a more vulnerable state than they are. And so we're very proud, and that's why I also wanted to give thanks to our employees across the state who do this work and serve. And I like to say that this work is hard work, but it's heart work.
Yes.
You have to have a heart to do this work and to stay in this work for years. So thank you all for having the heart to do the hard work that it takes to serve Marylanders.
Thank you. So on that note, we will end your panel, but as always, we ask that you remain pleased for the second panel. We have a couple of witnesses who have signed up. Thank you so much. So we have 4 witnesses who have signed up. I'll call each of you please to the table. So we have Lisa Klingenmeyer with the Maryland Family Network. We have Shernay Parker with AFSCME Local 112. We have Kaylee Shumitz with the Maryland Center on Economic Policy. And we have Michelle Medeo with the Homeless Persons Representation Project. And Michelle, I see you have a little guest. I'm so happy to see that. No, he's welcome to come to the table and introduce himself if he'd like to. If not, that's okay, whatever he's comfortable with.
Trying to be discreet.
Amazing. Welcome all. So you can start with whoever and just introduce yourself, please, and welcome.
Thank you, Madam Chair and members of the committee. My name is Lisa Klingenmeyer. I'm the Deputy Director of Policy at Maryland Family Network. And we're here today in strong support of the Department of Human Services, the Family Investment Administration. These are vitally important programs for low-income families. We very much appreciate that the governor and the administration in a particularly struggling budget year did not have any cuts to these programs in fiscal year 26, have supported these programs at their current funding levels. One thing we do want to express concern about was the #1 key observation from the DLS analysis, and that was when the temporary cash assistance and temporary disability assistance are calculated, they're done so using something called the Maryland minimum living level. And that is usually done every October, but for the first time it was not done this October. It was not done until later. So that meant that families were living below 61.25% of the Maryland minimum living level for 3 months. So already we peg temporary cash assistance when combined with SNAP at 61.25% of the Maryland minimum living level. So these are families who are living in deep poverty. For a family of 3, we just now, for the first time since 2019, increased their amount to $753. That's what the TCA amount is now if you are a parent with 2 children, and then you would get a SNAP benefit. But for October, November, and December, they were living below that. And so that is something that is concerning. We don't, as it is 61.25%, we think is far too low, and we've advocated for a long time to start increasing temporary cash assistance to bring folks up to the Maryland minimum living level. But certainly we should be expeditiously making sure that at least we are keeping families at that amount. So that is something that we are concerning. We also just want to highlight, and I know my colleagues will do this, that in general, the TANF block grant is spent a small percentage on cash benefits, and a lot of it goes elsewhere. So we really would like to see more of that TANF block grant spent on cash benefits so we can start looking at moving folks above the 61.25% of the Maryland minimum living level. Maryland has the highest rate of deep poverty in the entire country. So of folks who live in poverty in Maryland, over 1 in 2, 51.23%, live below 50% of the federal poverty line. And so it just makes it extraordinarily difficult for families to build economic security on that little income. So we thank you for your time, appreciate the work of the department, the importance of these programs, and happy to chat more.
Thank you so much. And I apologize, I forgot to indicate 2 minutes per witness. Please accept the young one. He can have as much time as he'd like. All right, go ahead.
Thank you, Chair Shetty and members of the committee. My name is Callie Shumitz. I'm Vice President for External Relations with the Maryland Center on Economic Policy. Again, also here in strong support of the budget and appreciate the full funding of these vital income assistance programs and particularly benefits theft replacement. We think it's really important to continue these. Our organization has long advocated for using more of our TANF block grant funds for what are the core TANF purposes, particularly cash assistance. So according to our last analysis, which was a little outdated now, but only about 30% of our combined TANF funds is going to core purposes. And so we're concerned to see the continued and increasing use of TANF funds for foster care and child welfare, while those are also critical needs. Using those funds makes it harder for Maryland to use strategies that other states are using to increase TANF related cash benefits to families. I think the other thing that we're concerned about, in a time when low-income families are facing a lot of economic challenges already, and there's the threat of harmful federal actions, I think it's really important to make our family income supports easily accessible. So we were concerned, as you were highlighting it with your questions, Chair Shetty, about the rate of some case closures that were highlighted in the DLS analysis, and particularly the cases being closed due to child support compliance. We think there are better alternatives than cutting people off of cash assistance they really need. It's better for families, communities, and the state when people can access cash assistance, and it can ultimately be more costly if people are getting cut off of this cash assistance and they end up homeless or have more severe emergency needs. Hope you can take that into consideration. Thank you.
Thank you so much. Go right ahead.
Good afternoon, Madam Chair Shetty and delegates, members of the committee. My name is Michelle Medeo. I'm Director of Economic Justice with the Homeless Persons Representation Project. While the department is doing a lot of great things, I'm going to focus my limited time on 2 concerns that I noted in the reports. The first, as my colleagues mentioned, is TANF spending patterns. So I was pretty disappointed to see that Maryland has spent down the unspent TANF reserves in the amount of just about $50 million. This is really disappointing because there have been a lot of great bills over the years that would have raised the TCA benefit level. There was another bill a few years ago that would have provided a housing allowance to families who are unable to get into subsidized housing due to long wait lists. There was another bill that would have stopped the department's practice of reducing TCA by $60 when a family does live in subsidized housing. And these bills have not moved out of committee due to the department saying that they're just, philosophically they're great bills, but they just don't have the money. So it's very disappointing to see that there was the money in the unspent TANF reserves in the amount of $50 million, and it's just been spent down. Another concern I just wanted to highlight was this alarmingly high TCA closure rate for failure to cooperate. So there was a bill that the General Assembly passed during the 2020 session. It was House Bill 1313, and it eliminated the practice that was very, very oppressive practice of closing the full TCA case when a family is not complying with child support or not complying with work. And in its place, the TCA statute now provides a partial sanctioning scheme where if a family is determined to be non-compliant, first, the department has to conduct a 30-day conciliation period to try to figure out why, if there's an exemption, good cause, what the department can do to help. And if there really is no compliance, then the maximum penalty is a benefit reduction by a very small percentage. In the cases, I am an attorney and I represent families for free and appeals when they've been wrongfully denied and terminated. We've seen a high number of cases where families should be getting their statutory rights of the conciliation period and the partial closure, but instead they're just getting full case closures. So we're very concerned by this. I know the University of Maryland School of Social Work just issued a report for the General Assembly after a thorough 2-year review. They also found that there's this troubling inconsistency between what the statute requires and what the department's policy is. It's kind of like a workaround is how they characterized it. And the department's COMAR regulations haven't been updated since 2014, and that's what the staff usually come to the hearings arguing outdated COMAR regulations. So I just wanted to add that because I think that could, it's not that families are not complying, it's the statute is not being followed in my clients' experiences. So
Ms.
thank
Madeo,
you.
Thank you
Thank
for
you
your
very much.
for your testimony. I know in our DHS panel, we talked about wanting to pursue some of this conversation offline to get to some good place. So I would love, if possible, for you to join for that conversation with me and the DHS team and whoever else is appropriate. So we'll follow up offline.
great.
Well, first, we have a fourth witness. Does he want to say hi? Into the you want to say your name and say hi?
Do you want me to tell him?
Yeah, that's
You can say your name.
if you want.
You don't have to.
You don't have to if you don't want
Yeah,
to.
let's say it at the same time. 1, 2, 3. Eli.
Nice to meet you. Thank you for joining us today.
Say thank you.
How old are you? You show us on your fingers? No, not right now. 1. I don't think that's true. I have a 9-year-old. I think I know you're bigger than a 1-year-old. 5. Thank you so much for coming and joining with us today, Eli. Do any members have questions for our panel or for Eli? Oh, yeah, welcome. Okay, great. Thank you so much. I really appreciate your testimony and your advocacy today. That concludes our second and final panel. I really appreciate everyone being here. That concludes our budget hearing for today. We will see you soon. What's her name?